Everybody, and welcome once again to a weekly media briefing and public health update with Montgomery County Executive Mark Elridge. I'm Lorna Virgilla, Hispanic Public Information Officer for Montgomery County Government, and joining us today is Health Officer Dr. Keisha Davis, as well as Dr. James Bridgers, who is the Chief of Public Health Services. Mr. Sean O'Donnell, Program Administrator, Public Health, Emergency Preparedness and Response for the Department of Health and Human Services. Joining us today as well is Dr. Earl Stoddard, who's the Assistant Chief Administrative Officer, and Chris Conkling, who is the Director of the Department of Transportation. We do have a special guest today, Ms. Laura Mitchell, who is the Chair of the Montgomery County Alcohol and Other Drugs Abuse Council. Thank you for joining us, everybody. Members of the media, remember to use the chat during the Q&A portion of this presentation. And with that, I toss it to you, Mr. County Executive. Good morning.
Good morning, everybody. So thank you for joining us again today. We've got a lot to get to today, from talking about fentanyl use, particularly among teens, to an update on a money-saving program run through our Department of Transportation. And I'm glad that Chris Conklin is able to join us today to talk about changes to Fair Share. I also have Laura Mitchell, Chair of the Substance Use Prevention Committee, here as well to talk about concerns in the community following recent overdoses. First, though, I want to address the continued anti-Semitic incidents that have been occurring in Montgomery County. This past week, we saw anti-Semitic flyers distributed in the Kensington area, falsely linking ancestors of our Jewish community to the cause of slavery. And last week, students at 3 schools were punished for drawing swastikas on desks in their classrooms. Last month, it was anti-Semitic graffiti painted outside a high school in Bethesda, and some teachers were sent anonymous and disturbing letters. In the fall, we dealt with more anti-Semitic messages on bus stops and fences near the Bethesda trolley trail. Police are still investigating these incidents, and a new $5,000 reward was recently established by the Jewish Community Relations Council of Greater Washington and the Jewish Federation of Greater Washington for information that leads to an arrest and conviction. Anyone with information about these crimes can call Crime Solvers of Montgomery County at 1-866-411-TIPS. It's not just anti-Semitic incidents of hate, but we've also seen vandalism in historic Black churches, hate crimes against our Asian American Pacific Islander community, as well as protests from Proud Boys trying to intimidate our LGBTQ plus residents. There's no easy way to put an end to this act and these acts of hatred. I wish there were, but we're actively working with police, the community, and other partners to solve and prevent this behavior. And if you are aware of it, if you see incidents of this, please report it to the police. If you have any inkling about who may be doing this, please contact us. We need to put a stop to it. We need to make it as difficult for people to commit these kind of acts as possible. Before we get into our health updates, I wanted to take a moment to highlight our Fair Share program that is very important to our climate action plan goals. Today, we have Chris Conklin joining us to update you on 2 new initiatives that our Department of Transportation is engaged in that are designed to encourage drivers and riders to change their current habits to help reduce carbon emissions. One program benefits our ride-on bus users, and the other is an expansion of our efforts to make charging stations more accessible for electric vehicle owners. Both programs are extremely helpful to our climate action plan goals to reduce greenhouse gas emissions. As you know, greenhouse gas emissions are cut in half when a commuter uses public transportation as compared to using a personal car. And 40% of Montgomery County's greenhouse gas totals come from automobiles. This is a key sector that we have to address if we're going to reach our goal of 100% greenhouse gas emission reduction by 2035. Fair Share can definitely help, and we just need business and commuters to utilize these benefits. So I'm going to turn it over to Chris for a moment now to kind of explain what this is and take any questions you have about the program. Chris, it's all yours.
Chris?
There I go. Sorry for that.
Oh, we hear you now. Perfect.
Good morning. I'm looking forward to sharing some of the details of the Fair Share program. This is a program that Montgomery County has had in place for quite some time. And the benefit of this program is it allows employers to provide free or discounted transit or parking access at metro parking lots. The county will participate with employers to provide a financial incentive and a tax-free benefit to employees up to $300 a month for their commuting expenses, as long as that workplace is within Montgomery County. As a business, you would be responsible for the first $25 of these costs, and the remainder of the benefits provided to the employee would be reimbursed by the county up to the budget available for this program, which is $150,000 for this fiscal year. This is a program that obviously did not have a lot of enrollment in 2020 and 2021, and we're hoping to see more engagement in this program as the benefit to employees has increased by $20 from what was previously $280 under the IRS guidelines to $300 per month this year. So your employees could be getting a very substantial tax-free commute benefit here, as high as $3,600 per employee per year. And the program can provide up to $40,000 to any employer willing to participate in this to fund this program. So very exciting program, a very substantial benefit and incentive for those employers that have employees returning to the workplace, and we'd like to encourage them to rediscover public transit as the preferred means for their getting to work. The other another item I'd like to share that will be announced later this week is that we have added more ports, electric vehicle charging ports, to the county network. We're up to 56 charging locations operated by MCDOT, and that's serving the largest number of plug-in vehicles that are registered in the state of Maryland. 19,000 plug-in vehicles in Montgomery County, and that's a third of all of the plug-in vehicles statewide. So great track record so far in electric vehicle adoption. And we're hoping that the addition of these ports will encourage people to continue to purchase electric vehicles instead of traditionally fueled vehicles. 8 of these ports are added in the NOAA garage in Silver Spring. 4 were in the Cordell St. Elmo garage in downtown Bethesda, and 4 in the Wheaton Marketplace garage next to the Wheaton Metro Station. There are 8 more planned that will happen in the Bethesda Elm garage in Bethesda, and in the Cameron Street garage in Silver Spring later this year. This is interesting. These ports are being installed as part of a cooperative program with Pepco. They are installing and operating these, and they're slightly different and will have a different account system than the chargers that we already have that are operated by ChargePoint. And I do want to note we had some reliability problems with the EV charger due to supply chain issues and replacement parts. There's been a sweep to get all of those repaired and operational. If you encounter a charger that isn't operational, please let us know through 311. But we're hoping that we have a much better experience now that those supply chain issues seem to have worked their way through the system. The other thing I would want to note is that there are 1,600 other EV ports operated by other entities around the county. So you'll find these in retail locations, in other public facilities like libraries and rec centers. But accessing EV charging is nowhere near as challenging as it was a few years ago. It is becoming less of a barrier to EV adoption. You can also install EV charging in your home. In 2020, DOT and the Department of Permitting Services released guidelines for installation of electric vehicle charging stations at your home in locations where you don't have your own off-street parking location. The third thing I wanted to talk about today was the continued implementation of our zero-emission bus transition plan. This county executive has recommended $2 million as part of his capital budget for us to begin planning for a new depot that will allow us to fully convert the fleet to non-carbon fuel sources. And we are also implementing work on our hydrogen fueling pilot at our Gaithersburg depot now, and that's going to be part of our mix going forward. So very exciting announcements there. And then the last thing I wanted to talk about a little bit today is that the ride-on schedules will be changing this Sunday. We are having time changes on 31 routes. We will be increasing service on about 29 routes, and we have 4 routes that the service is actually being reduced because the ridership is relatively low on those. And I have to admit, we don't like to have route reductions, but one of the routes that is having a schedule change with less service is the one that I use most frequently. So these are not, these are truly the routes that are having the lowest ridership in our system. And that service is being transferred to the places where we are seeing more ridership. You can find information about the service changes on our website. And again, that will be going into effect this Sunday. So happy to take any questions on any of these programs.
Thank you, Director Conklin. Members of the media, we are going to open it up at this moment for any questions regarding fair share and or other transportation topics. We'll wait a second or two to give you the opportunity to get engaged.
Laura, can I jump in here?
I see it. All right, go ahead, Mr. Steve Bonnell with SW8. Good morning.
Good morning. Mr. Conklin, you mentioned that for the fair share, the tax credit is increasing up to $300 a month. Is that from a lower figure? I guess, what was it at before this change, I guess?
Yes, it was $280, and the IRS has increased that level to $300 this year.
Okay. And just want to actually talk about the bus routes too. What data did you use? Can you just explain the methodology a little bit more about what went into increasing service on those roughly 29 routes and then decreasing service on the 4? Is it just obviously, I mean, I'll just let you speak to that, I guess.
Happy to, Steve. We have automatic passenger counters on each bus, and they're able to let us know how many people are using the service. So in those locations where we start to have some crowding on routes, we look to add service, and buses that have, very low ridership, perhaps some empty trips or a couple passengers per trip, we look to see if we can make adjustments to be able to use the operators and the vehicles more effectively in other places where demand is higher. We try to keep those minimum headways at a point where people can continue to rely on the service, and it's not so infrequent that it's unreasonable. And typically we try to keep the minimum time between buses at 30 minutes, but we go through this process normally 3 times a year to make these adjustments. In the last 2 years, we've been doing this on a much more frequent basis as we've been getting more operator availability and ridership has been returning to our system.
It might be testing your memory here, but I see these emails come through that, you're looking at a route or a couple routes, and that obviously this is a substantial amount of routes, 30. Is there a precedent here for where the county's taken this much action on this many routes? Do you follow what I'm asking?
Yes, I mean, in our previous normal mode of operation, we would be making adjustments to our route system wide about 3 times a year. So this is not unusual, but as Steve, as you note, over the last 18 months, we've been adjusting the route network more frequently as we've restored service as bus operators have become more available due to the county's program to increase pay and increase the number of activities we're doing to recruit bus operators. And that's been matched by some return in our ridership that we've seen over that same period.
Okay. Thank you, everyone.
Thank you, Steve. Members of the media, any more questions regarding these transportation topics for Director Conklin? No more questions? Okay, going once. Twice on this? All right, thank you, Director, for joining us today, this morning. And Mr. County Executive, we can transition now to the public health update and other topics.
All right. Yeah, thank you very much. And thank you, Chris, for joining me today. Unfortunately, we're seeing more young lives put in jeopardy because of fentanyl. And earlier this month, a 15-year-old died from an overdose. It's one of 8 recent overdose deaths in Montgomery County. The Montgomery County Fire Department has reported an additional 38 people would have been killed since December, if not for the life-saving drug naloxone, also known as Narcan. And just yesterday, we had another overdose in our schools. Opioid misuse and overdoses have been a major public health problem in our county for several years. But more recently, the use of fentanyl and pills in the younger age of those misusing drugs is very concerning. Last year, youth overdoses in Montgomery County alone increased by 78%. Non-fatal overdoses in youth went from 22 in 2021 to 37 in 2022, and fatalities went from 5 in 21 to 11 in 22. So these are significant increases. Fentanyl is a synthetic drug that mimics opioids, and it's pressed into pill form so that it looks like and is sold as other drugs. They literally look like a drug that is not what they are. Users taking the pills may not realize the danger they are putting themselves in. And nationally, 71% of adolescent overdose deaths in 2021 involve fentanyl. This Saturday at Clarksburg High School, MCPS is hosting a fentanyl awareness forum for families, helping to give them the tools for prevention and helping protect our children. It's free. It's going to take place from 9:30 to 11:30 a.m. in the school cafeteria, and the forum will also be live streamed on the MCPS homepage. I invited Laura Mitchell, who is a substance abuse prevention committee chair for the Montgomery County Council of PTAs, who will be on today's briefing to give you some remarks and take any questions you may have. And I want to thank Laura in advance for joining us. Since September, hospitals in our areas have been dealing with triple threat of RSV, flu, and COVID-19. The tridemic has put constant pressure on our hospitals for many weeks now, and it strains their capacity, and it's prompting warnings from health experts to consider treating mild cases of COVID-19 through your doctor and avoiding the hospitals. This week, our hospitals remain nearly full, but our COVID-19 counts are showing signs of regressing. And as you can see from the drop in cases in this chart, this may seem like we're out of the woods, but we're not. The percentage of hospital beds devoted to COVID patients remains elevated and keeps our community level status at medium. Additionally, emergency room activity is still high, and we're recommending to residents to use only the ER for life-threatening issues and use urgent cares, primary care, and telehealth to ensure that our emergency departments are available to those in urgent need. We talked about this, last week, I think a little bit, but our ambulances are still backing up. They're getting to the hospital, and the hospitals have so many patients, they're not able to process the patients that are coming in by ambulance. And when you're not able to process them, they wind up sitting in the ambulances, and those ambulances aren't able to return to service. And that puts our supply of ambulances under strain because we count on them being able to deliver patients and then be available for the next call. So when they're tied up at hospitals just waiting to get into the emergency room, this creates a health problem down the chain. So be aware of that situation. Go to the hospital when you need to, but if you don't need to, please take advantage of other services that are available. Vaccines and boosters continue to be the best form of protection, and we can tell by COVID rates this winter as compared to last year, they're working. And this chart shows you, this is cases by vaccination type, and it looks at the number of breakthrough cases. And as you can see, there are significantly fewer breakthrough cases in all age ranges for people who've had the bivalent booster than for people who had the original booster. And so this chart kind of reinforces the message we've been trying to send to people, that the booster, while not 100% effective against getting sick, it's much more effective against getting really sick. And so please go out and get your bivalent boosters if you haven't done this already. As we'd like to remind people, or don't like to remind people, there's really no reason for people to be dying of this anymore. We have the tools between treatment and vaccines to prevent death. And the fact that people are playing Russian roulette and not getting vaccinated continues to put more people at risk. We continue to see demand for bivalent boosters continue to drop, and that's one of the problems. And this chart was broken down by age and race of who's taken the new booster. I'm very concerned that 46% of our 65 and older population has not yet taken their bivalent booster, as that age cohort is the most vulnerable to serious illness or death from the virus. And that's something we've seen from the very beginning of Corona. These were where the major amount of our victims came. It's also isn't a good sign that only about a quarter of all adults 18 to 49 in the county have not gotten this new shot either. That's too many unvaccinated or unprotected people out there. So I'm going to turn it over to our public health team now, as well as Ms. Mitchell, for their remarks, and then we're going to take questions. Thank you.
Thank you, Mr. County Executive. I'll share, as we do each week, a few more metrics that we're tracking on COVID and some of the other infectious diseases. Again, we're as the county executive said, our case numbers have been coming down a bit. You can see here still the significant elevation of individuals in the hospital with a COVID diagnosis. We know that some of these are people who are there because of COVID, and some COVID was identified during another visit. Looking along the East Coast, we've seen our other neighboring cities on the East Coast also have this decline in cases, so that's encouraging, but we still remain at an elevated level overall. And as you can see from our emergency department visits, these are snapshots each day of the number of patients at emergency departments. Again, this past week, we had another day where we had more than 300 patients in our EDs. And this is the strain that our county executive was referencing and is extending out to our EMS units as well. With fewer cases, some of the questions, why is there still strains on our hospitals? And some of it is the different type of patients that they're seeing now. Whereas the previous few months, it was a lot of pediatric patients, many of whom have speedier recoveries. You can see from our chart here, these are just patients with flu-like symptoms that range from COVID to influenza to other respiratory disease. A lot of the patients now are our seniors, and certainly they can sometimes have longer stays and require more rehabilitation after a serious illness. We're still tracking our variants. The XBB variant is now projected to be well over half of our new cases in our region. And again, we've had another month with January already where we're seeing more than a death a day with a COVID diagnosis. So again, we're still at a time of year where this is of significant risk to our residents. Looking at influenza, we are seeing the cases of influenza recede across the nation, and this appears to be similar to what we saw with RSV, in that it happened early, it happened very quickly at a very high level, and now it's starting to recede. You can see the yellow lines there is this year. The red lines are the activity we had back in 2019, 2020, before COVID became a more significant illness here. So you can see it's kind of hit at different times and at different volume levels. And the mortality associated with influenza across the state is now up to 52 deaths. And then finally, again, we're happy to report that across Maryland, there have been no new cases of Mpox this past week. Those are the updates I have from our pulse report. And would like to give an opportunity for Dr. Davis, Dr. Bridgers, or Dr. Stoddard to add anything additional if they'd like.
Thank you, Mr. O'Donnell. Great job. I think really the highlight messaging here is also what the county executive highlighted earlier. There are some promising signs that we're starting to turn the corner on COVID, but we're still seeing significant backups in our hospitals. And so continuing to protect the vulnerable population, the elderly, encouraging them to get their boosters, everyone to get their boosters. That's how we're going to slow the spread, and really saving the emergency room for emergencies using your PCP, urgent care, telehealth, all of those other modalities, so that we can keep our emergency rooms open and efficient to take care of those crises. When our ERs are full of COVID, it makes it harder to attend to other things like strokes and heart attacks and car accidents that we know that they're still seeing every day. Dr. Bridgers, Dr. Stoddard, anything else to add?
Sure. Thank you, Dr. Davis. Mr. O'Donnell, I have nothing else to add to your comments and Mr. O'Donnell comments. I will turn it over to Dr. Stoddard at this time.
Yeah, the one note I wanted to provide is I've seen some inquiries online about from individuals who got the bivalent vaccine very early in September 1st. There is no recommendation yet from the FDA or CDC about when another dose of the bivalent vaccine will be appropriate. And so we will be sure to provide information to the public about when that should occur. But the reality is that, you know, at least for a solid 6 months after that first vaccine, you're going to likely still have very, very high levels of protection. And so my sense is probably sometime in the spring, you will see a recommendation coming from the FDA or CDC on what the future of the bivalent vaccines are. So I know some of our elderly or immunocompromised residents have asked questions about that, and we will be sure to provide information as we hear about what the federal government's recommending with regard to additional booster doses in future months.
Thank you, Dr. Stoddard and HHS team. Ms. Mitchell, opening remarks from you before we open it for the Q&A portion of this presentation.
Hi, yes. I do appreciate the time in addressing everyone today. We have a forum on Saturday, as was mentioned, the family forum on fentanyl, because we are seeing increases in youth use. And that is not exclusive to Montgomery County. I know when you're the first ones that are really talking about it, which is the first step in solving it, it tends to get a lot of attention. This is a national problem. This is not an MCPS problem or Montgomery County or even Maryland problem. It's everywhere. It's unfortunate that we are seeing this more and more in our youth. We say, you know, the numbers are trending down overall, but that's from a historic high, even for adults. So this is something that affects absolutely everybody, anybody. It can happen from an accident or an injury. It can happen from a wisdom tooth pull or any of those things. So we want to share that information. I have lived experience with my child for 15 years in active substance use disorder, and he's 7 years in recovery now. And I look at the things that I know now, I wish I knew then. And that's our mission, is to try to, through Montgomery Goes Purple, not just celebrate recovery as we did in September, but to work on the prevention all year long, so that our youth and other people never have to look for recovery or work so hard for recovery. This thing is like a really pretty jacket that you put on from the store, and it looks wonderful and you can't wait to wear it. But every time you put it on, it gets a little bit heavier and a little bit heavier. And then at one point it locks on and you can't take it off ever. And that's what we need for our young people to know. We need for our parents to know what to look for and what to do if you see something that's concerning, how to get help. Those are the things that we'll be addressing at this forum, and it's critical. We'll also have Narcan training and distribution there. That's the overdose reversal drug. And I would personally be happy if everybody had it and was trained to use it, because it's very, very simple. It's safe to use. Nothing happens if it's not an overdose and you find someone that's unconscious and you use it. Nothing happens. And it's free. And you don't know whose life you might save or what they might go on to do. I think it's really important. Every single person, it may be the first time they tried something, and everybody is vulnerable to it, and everybody is worth saving. So that's the mission of Montgomery Goes Purple, and partnering with MCPS to get these information sessions and prevention work in the schools, and getting students who we've missed that prevention window on into treatment. That's our goal. That's what we're working for here.
Thank you, Ms. Mitchell, for those remarks and for joining us today. Members of the media, now we're going to open it up for the Q&A portion of this presentation. Remember to use the chat. And up next, first is actually Stephanie Ramirez from Fox 5 DC. Good morning, Stephanie.
Good morning. Happy New Year, everyone. Haven't talked to most of you since. Just want to ask the county executive about the illicit drug and fentanyl use in Montgomery County and the concerns. One thing that we're continuing to hear from parents is the concern that certain communication cannot be shared because of FERPA and HIPAA laws. Specifically, we were told by the county's school press team that they cannot share if a specific overdose happens, and they can only share if a fatal overdose happens after the parent gives permission. County executive, has anyone raised concerns to you about this? And is there anything that your office can do if you are looking at this in regards to how to share some kind of information or get the information out there more to these parents in this matter?
Please unmute Mr. County Executive.
I'm a little confounded by the question because I just read you a number about the number of non-fatal overdoses and the number of fatal overdoses. So it's not that the numbers don't go out there. I don't know. Nobody from the school system has talked to me, and nobody's spoken to me about what the school system may be saying about HIPAA. I do know that they can't tell you who overdosed. There may be a different case if it's a fatality, but you cannot report somebody's health condition any more than they can tell you who tests positive for a COVID test. So that may be one of the limits of the HIPAA law, but I'm not in position to answer that. These aren't decisions we make for the school system. They get this from their legal staff. And the question might be, is this true in all schools in the state? And is this a state policy? I don't know whether any of the folks on our medical team know what the HIPAA rules are, but if you know them better than I do, let me feel free to join me.
Well, so FERPA obviously guides what schools can release information about the students, and that's obviously much different. It's has complexities even beyond standard HIPAA, which obviously the Health and Human Services, and I'm sure all of the public health officials could speak to HIPAA, but obviously FERPA applies to different standards as well. But the one thing I would say, Stephanie, is it shouldn't matter a whole lot, because I think every parent of a high schooler, and I have a 13-year-old, so I've had this, I quite literally had the fentanyl conversation with her last week, given what we've seen in MCPS. Like it seemed ludicrous to me at the time to talk to a 13-year-old, but it's not. We are seeing younger people experimenting with narcotics or even what they perceive to be prescription drugs that are often laced with other things. And so, frankly, from a perspective of a parent, you should assume that if your child is in a high school at this point, it's not the exclusive issue of Silver Spring or Germantown or even Montgomery County that they're going to be exposed to opportunities to, for potential taking of prescription drugs and overdoses. And so I think to a degree, it might give you a false, if you're only focused, I'm only going to educate my student when I see an overdose, you're missing an opportunity to have prevented that your student being that overdose by having the conversation with them early and often about the risks of taking prescription drugs and not knowing what's in them, peer pressure with regard to taking unknown substances from other people there's a lot of contamination of even prescription medications or things that look like prescription medications that are often not prescription medications.
Could I just tag on to that for a second? The American Pediatrics Association recommends that doctors begin screening for substance use at age 9. So even middle school is not too early to start talking about it. It's not even just high school. It is a conversation even with kindergartners about not putting things in their mouth that look like candy if they weren't given that by their parent, their gummies and lots of other things that look like candy, even the rainbow fentanyl. So it's important to have those conversations, as Dr. Sutter said, very early, very often, and with appropriate language. On the montgomerygoespurple.org website, you'll find information about appropriate language to use. If we don't use the right language, we are telling our kids they're bad people, making bad choices with bad parents and all of these things. So when they are faced with this, who are they going to go to? They don't want to make their parent a bad parent. They don't want to be a bad person. So it's really important that we use the right language when we're talking about this and invite them to talk to us and make it easy by starting those conversations.
Thank you. Thank you, Stephanie. Do you have any follow-up questions, Stephanie? You're good?
No, that was it. Thank you. Thank you all.
Okay, great. I see Zoom user hand up. I believe that's Paul Wagner, MBC4. You're up next. Go ahead.
You're right, that is me. Question, does the security staff at the high schools and the middle schools all carry Narcan? And secondly, with the community engagement officers not on the grounds of the schools now, is there now, have you seen an increase? Now, let me check that question. Is there now a concern that perhaps where in the past where you had SROs approached by kids saying that there was drugs going around the school, now you don't have these community engagement officers on the campuses, so the kids are not going to these officers anymore? What do you make of that, Mr. County Executive? Do you have any comment on that? And of course, don't forget my first question about who's carrying the Narcan. Thank you.
Earl, do you know who carries the Narcan in the schools?
I know they're in all the health rooms, and so they're all the health room staff and techs have been trained on Narcan administration. I believe Dr. Braders can correct me if that's wrong, but I know that we're in the health rooms. And interestingly, at 10 o'clock this morning, we had our normal opioid intervention team meeting. So I attended that, and there was a very robust conversation between MCPS and county staff. Dr. Braders and was also there, so he can attest to this too. We're working on broadening out the number of people within the school setting who have access to Narcan and who have Narcan on hand as we, as a response to the increase that we've really seen over the last year and a half or so. And so all the health rooms do have it. We're actually talking about putting it in all of the locations where AEDs are throughout the building, so that it's much more ubiquitously available for potential overdoses. And I guess, Mark, do you want to talk about the second part of the question?
Well, I believe the school still has the community officers in the schools. They didn't take them out of the schools this year.
Yeah, so the CEOs are still associated with all. They're not. I think he's getting to the point between the SROs and the CEOs and the differentiation there. But the CEOs are still. I mean, as a reminder, the SROs also serviced entire clusters. They weren't necessarily always present only in the high schools, and as Ms. Mitchell referred to, these challenges exist in our middle schools and as well. And so I think the important point is that the CEOs are still engaging with students and talking to them. And that, I think we made the change even in the beginning of this year where they have an office in the space and students can actually go to them if they want to. They're just not proactively roaming the halls in the same way. And they're clearly not involved in student discipline in the same way that the SRO program had them operating previously. And so it's really taken them much more to being available to students and to faculty and staff and having a space in the schools, not necessarily being there. They were not in a high school 24/7. They weren't, frankly, as an SRO in a high school all throughout the school day. They're moving between the entire cluster. And so students can still go to the CEO in their school and will know who that individual is in their office if they wish to. But the reality is that even for the number of CEOs we had, there are tenfold more security staff. There are more administrators. There are more counselors. There are a number of people in the school setting that someone can go to and report issues that they see with, a prescription drug abuse or illegal substance drug abuse, if they wish to, and share information about it.
Can I follow up? Do you have any further details on how this young girl was found inside the bathroom yesterday at Kennedy High School? The radio traffic we were able to listen to said that she was unconscious and not breathing when she was found. Do you have any further details on how that happened?
Yeah, I'm not in a position to comment beyond what's been released at this point. Obviously, I certainly am not going to break laws that I'm not fully aware on FERPA, and so I'm not going to certainly be in a position to go any further than what you already know.
Does that answer all of your questions, Paul? Yes?
Yes, thank you.
Thank you.
Thank-
Could I make two quick comments? One is,
Yeah, go ahead.
okay, sorry. One is, Dr. Stoddard, I'm very glad to hear that we're talking at the community level, at the county level, about putting Narcan and the AEDs and bleed kits in the schools. It's something I've been asking for a while, because if our schools are huge, many of them are huge, and the distance between the nurse's office and wherever a student is found can be the difference between life and death. So that's really important. And anybody could carry Narcan. Anybody can walk into any fire station in Montgomery County and get Narcan for free. That's important to know for our students, for harm reduction reasons. And it's also important to know that anybody can carry Narcan. The teachers, the security staff, we're working on training them. That is critical too. Everybody, the more people have it, the closer you are to rescuing somebody and saving their life. And at our forum on Saturday, we will also have a vaccine clinic adjacent to that. And anyone 50 plus that's getting a vaccination will get a grocery gift card. So we are really targeting, with this grant that we have from National PTA, getting our 50 plus community vaccinated and boosted. So I encourage you to come and learn something and get your vaccine.
And just because we're talking about the forum on Saturday, Director Conklin and I have been going back and forth on this today. We can announce also the bus routes 10 and 75 will be free, and those routes will serve it free from 7 a.m. to, I believe, 2 p.m. on Saturday, to allow more people to attend the forum without having to worry about how they can get there. So those two routes during the 7 a.m. to 2 p.m. Timeframe will be free. Obviously, you know, the county executive has made very clear that it's important that we make opportunities available to all of our residents. And so, you know, talking to Director Conklin, we're going to, you know, we believe that will be an additional way for people to feel that they can participate and not be excluded based on. And I will also note, this was actually a recommendation that came in from a county resident, Bridget Howe, and we thought it was a really good suggestion. So I want to credit her for the suggestion, and we're going to make it happen. So thank you.
Thank you, Dr. Stoddard. Ms. Mitchell, can you remind all of us of time and location for this forum on Saturday?
Yes, the location is Clarksburg High School in the cafeteria. The Coke trailer will be parked right outside of there, the mock teen bedrooms so adults can tour. The time is from 9:30 to 11:30, but the resource tables and the Coke trailer will be there at 9. And we hope to see everyone there. We'll have refreshments and a lot of information.
Thank
and
you.
Free Narcan.
Thank you. Members of the media, any other questions for officials? No questions? Going once? Twice? Well, I guess we're done for today. Thank you, everybody, for joining us. Stay safe and have a wonderful afternoon. Thank you
all for being here.
Good afternoon, everyone.